Ted and Penny Crumley.
Hi.
Hi, we're on our third video, finally. We've been real busy, so sorry we've been delayed again, but we hope to keeping these videos coming. This is video 3 about the stem cell transplant, and we decided to come outside since the weather is nice, and it's kind of a nice fall day, warm fall day, and as I began to think about talking about the stem cell transplant, I felt like it would be a good idea to give not only my account of it, but Penny as the caregiver memories and accounts of it. Me being Ted, the patient, and Penny being the caregiver and also / nurse who knew a lot of what was going on. And we're just going to share what I remember about the transplant, and then she's going to share what she remembers most about the transplant. Myself, I remember meeting the information meeting. We met with the doctors and the nurse,
Social worker.
and the social worker, and just everybody involved. And the plan was to give me a heavy dose of chemo my first day of entry into the hospital, the day before the stem cell transplant. And also about a month before the transplant, we went in for a stem cell collection, they call it, where they hook you up to this IV, and they begin collecting stem cells. Now, this can take up to 1 day, maybe 2 sometimes. In my case, it only took 1 day, so that was good. But we finished in 1 day, and the hospital check-in.
It's pretty cool. The machine actually counts the number of stem cells as it goes in.
Yeah, and I looked behind myself, thinking, what does this look like? And it just looked like a big bag of blood. So, but it was kind of strange, and of course that was pre entry into the hospital. That collection was done before I went into the hospital. The stem cell transplant actually took place later. They did freeze about half of my stem cells for possible later use, maybe. Also, they froze the ones that they were going to use as well, and those were used during the stem cell transplant. And of course, they have to be unfrozen, and whatever they do to them to prepare them for entry back into my body. The hospital check-in on the day, my first day in the hospital, was very smooth. They were ready for me. We were ready. They'd given us a lot of information about what to bring and everything, and basically it was just like packing for a vacation, although it wasn't a vacation at all. But it was very similar to packing for a vacation. I do remember at one point in the stem cell process that I got a little sick, maybe a couple of days after the transplant, and I began to get a fever, a little over 100, I guess, and of course Penny's been my wife for over 30 years, so I know when she's worried. And I could tell by her face that she began to get a worried look on her face. And I tried to stay peaceful, tried to stay calm, and I did stay pretty much calm the whole time. I just took it easy for a couple of days. One thing, if you ever want to get out of the hospital, no matter what situation you're in, and of course you have to do it safely, but they do require you to walk at least, I can't think, it was 4 rounds around the section that we were in of the hospital.
It was almost a mile he needed to walk.
And so I was walking every day, trying to stay in good trim, good fit, and stay strong as I could be. And for those couple of days, while I was sick, I didn't walk. and that was the nurse's suggestion, while you're weak, don't walk. We don't want to risk you falling or anything like that.
Just to tell you, he says a couple of days. It was more like 4 to 5 days. There were some days that he does not remember at all.
Yeah. After 16 days in the hospital, they all kind of ran together. So, I was surprised when I found out in discussions of the stem cell transplant that I would lose all my immunizations that I'd received as a kid. All my COVID vaccines, flu vaccines, chicken pox, whatever vaccines I got when I was young. I lost all of those because of the stem cell transplant. So that's pretty much what
Your parents.
Oh, and I also noticed recently, I was reminded I got my fingers printed for the airlines doing a
TSA pre-check.
pre-check thing, and I remembered that they said that my fingerprints would likely change, and they were very hard to get, to show on the machine. They were doing it electronically. It was very hard for them to show on the machine. So it was interesting that I actually lost some of the imprint on my fingerprints. And that was one of the side effects, many side effects of the stem cell transplant. And quite frankly, other than 16 days in the hospital and the heavy chemo, I lost my hair for the first time. The previous chemo I did not lose my hair.
The first day with either the first or the second day, I think it was the second day, just before he started getting the chemo, the really heavy dose, he had to actually keep ice in his mouth. And what it did was it numbed his mouth so that hopefully it would keep from causing ulcers in his mouth. That chemo is very strong.
Yeah, and it was, just sitting in the chair, it was like taking any other chemo. Of course, my previous chemos were done by injection, so I was not real familiar with using a port and everything, so that was a little different. But everything, other than those few days, everything went pretty well. And this is a little over a year in, and I'm still in remission. So I'm just thankful for that. I'll let Penny share what she remembers. So.
Yeah, he leaves a lot of stuff out in regard to all that chemo stuff, because I think he has a memory and he doesn't remember most of the stuff because he was so sick for a lot of the times. What happens is that chemo, that heavy dose of chemo, will bring your white count down. And I'm not going into all of the nursing stuff, but it's supposed to bring your white count down to the basement, which means you have nothing. It wipes you totally out. That's why when people go for these stem cell transplants, no one can be sick that comes and visits. People have to wear a mask, things like that. So it's very intense, that first dose of chemo. And it's just that one dose, huge dose of medication that they give them. The ice, I had to go constantly fill up the ice bag. I was there to help him, to support him, to be his advocate, because I knew there were going to be times that he was not going to be feeling like talking, and then I was there to also assist the nurses with his care. I wasn't going to do any of the nursing care. I tried to put myself out of the nursing arena totally, although my knowledge constantly kicked in and made me very concerned at some of the things I was seeing. But the nurses always, allayed my feelings, tried to help me feel under that this was normal. So, talk to your nurses. They're there for you. The doctors are there. If you don't understand what the nurses are saying and you still can't get them to understand, it's always a good thing to have both your team as well as the nurses to talk to.
And it was required that I did have, as the patient, I did have to have someone there to assist me. So I believe that was required. And of course, naturally, I would choose my wife, and pretty much anybody would. But so understand that in this situation, you would need somebody there to maybe go get the nurse or something when you weren't feeling well or whatever. So, or or help ask questions or field questions.
The particular hospital we used required the person to be there. However, it wasn't always a requirement, because I saw people there that did not have anyone, and I felt so bad for them because they didn't have that extra support that they really needed. And I can't imagine Ted going through what he did and not have me there to help support him along the way. There were times he didn't feel like getting up out of the bed, and I would have to tell him and keep encouraging him. We've got to get up. You're going to get pneumonia if you don't get up. So it was quite difficult. So I don't see how anyone can do it by themselves. Some hospitals even actually do this as an outpatient. Excuse me, I definitely don't understand that, because the treatment that they give after the stem cell is they based on laboratory works. Every morning they take the labs, and then they come in and they treat those laboratory results by either giving platelets, blood, potassium, magnesium, whatever that person needs. I can't imagine having to stay close to a hospital at an outpatient or a hotel and getting up every morning really early to go get labs, and then wait till they call us to come back to the hospital if something needed to be given to him. Right there, we were at the hospital, we had the treatment quickly, and we had no problems. The nurses were excellent. They were appreciative of me helping. Not one of them ever said anything ugly about us being together and me trying to help him as much as I could. I helped him get baths. I made sure he had food. I tried to go get food that I thought he might eat. The taste buds change, so what he used to eat tasted different, still does at times.
Yeah.
And so I tried my best to keep him nutritionally sound. Myself, the food at the hospitals are not always the best taste, and I'm a very picky eater, so I did have a lot of difficulty. I was able to get food brought into me from the hospital. From outside facilities. I'd have to go downstairs and pick it up. And then some friends would also bring us some food to us. So if you have support system that you can rely on and you're close enough to the hospital that they can do that, I would say tap into them if they're willing to do that for you. Another thing, what I had read is that we possibly needed to do a photo album or have pictures up in the room. I'm sorry, the allergy always makes me a little coughy. But the album was mainly for Ted and myself, because we knew we were going to be in the hospital for at least 2 weeks. And I wanted us to remember what we were in there for. Not just for ourselves or just for Ted, but it was for our daughter, our immediate extended family, our friends, our church. It was for other people, not just us. Yeah, our cows needed us. Our cats needed us. Everybody needed us. So we wanted to make sure that we were kept up and supported that way. So I put a photo album together with various pictures of ourselves, our friends, a lot of our close family were in the album. Of course, all of our animals, our daughter and her husband and their animals. And so we were able to go through that photo album quite frequently throughout the stay. I also asked people to give us scriptures or phrases that would help us to encourage us every day. And our friends really came into play, and they gave us a bunch of scriptures. I was able to find a lot that meant things to us, that meant things to me personally. Ted picked some out that he wanted for himself. And then I put those on a Word document. Or actually, I used the Bible version app, and I actually put the scripture in one of their, I don't know what you call them now, one of their little picture things. And then I went I went to the CVS and or Walgreens, and I got the pictures actually developed, and I put them also in the album. I used those to give out to the nurses, to any staff that I felt like possibly needed an encouragement. I also gave it to family of patients that also came in, because I didn't spend all my time in Ted's room. I actually had to take breaks just so that I could have my own mental status. When he was resting, I would go out and sit in the little lobby area. They had a little visiting area where I could go sit. And I would talk to other people and other patients, other family members, and we would share our experience and what happened with us, you know, how we came about being in the hospital with our spouses or our loved ones. So it was a way for me to share my faith, and I also was able to give out the scriptures at that point too. Like he said, packing was like going on vacation. Our car was packed up. I mean, I had to go get a mattress for myself to sleep on so that I wouldn't be on a sofa bed for 2 weeks. So I had to get that. I had to take extra things for me to eat, you know, like snacks. He would eat snacks too, and some cereals and milk and things like that. So we took a few things for ourselves and our normal clothes and things, because we weren't able to wash clothes. They had a wash machine and a dryer there. I actually, while I was washing clothes every day, I got to talk to other patients. Some of them had to come from other floors to get their washing done. So I was able to actually reach out to other people as well. So I use this time wisely for other people as well. And I'm not a bold person. So for me to actually speak up like that, God really used this situation. Yep, I was concerned about his fever, very much so, because it kept going up. He says it was over 100, and I did get a little nervous about 100.4, but when it reached 102, I was real nervous, because that to me means he's gotten, somebody's brought something in, or he's gotten sick. They did blood cultures finally after, I think it was the second day of the temperature being really high. And those are the days he does not remember, when the temperature was extremely, extremely high. And I think it was about 2 days of that. And he didn't get out of bed those 2 days. I gave him sponge baths in the bed. He barely ate. What I could get into him was what I got into him. He woke up one afternoon into the evening time and was singing the song. We don't sing very well, so I won't even try to tell you what it was. But we called our best friends, and I just told him, I said, can you call me at some point, either tonight or tomorrow, whenever you can do it, and sing this certain song? And for me, I can't remember the song now.
I don't remember either.
But would you believe that our friends at 9 o'clock at night got up from bed and went to their piano and called us back and sang the song that helped him through that night, to help him feel better? So I'm telling you, rely on your friends, your support system, because it's very important. And then his birthday came up 2 days before he was supposed to go home. And he always is constantly telling me, I don't get a cake. I don't get a cake. Constantly. For months I hear it. So I finally got him his birthday cake, because this was kind of his birthday and his second birth, because that's truly what this is called. It's his second birthday. Yeah. So I brought the cake in, and lo and behold, he was sick. Nausea, vomiting, fever again. So I was like, well, okay, well, he's not going to get to enjoy his cake, and he might not get to go home. Yeah. But finally, he did get better, and we did have the cake, by the way, when we got home. I got him another one. So he said it still didn't taste good, but at least we did it. But I would say the biggest thing for me is to tell you to seek out others that can help you. Don't be ashamed or afraid to accept their love and their care for you. It's very important that not only you get their love and their support that way, but it's also important to them, because they feel that you want their support and they're needed. Don't take away their blessing, is what I'm trying to say. So I believe that's about all I've got to say. You see me getting teary-eyed because all of it just brings about a bunch of memories for me, and it's difficult sometimes.
Just to update you on my condition, after the stem cell transplant, a few months after I began what they called a maintenance program, and I started to take medications, 2 medications through my port, a new port that I'd received, and one of the medications actually I was allergic to. and I'll let you describe how that worked
It-
out.
I noticed that Ted was getting very slow of speech, slow in movement, and he just altogether wasn't acting right. And we got sick in December of last year, and I know he had a seizure. He wouldn't tell me, he wouldn't allow me to state that that was a seizure, but I knew that that was a seizure for myself. And but both of us were sick. We thought we had maybe a little virus, a cold virus, because both of us were sick at the same time. And then in February, he got sick again, and he had a seizure. And that was while our daughter was on the phone with us. I had to get her to call EMS while I was taking care of him. And then we had friends to drop by, and lo and behold, if he didn't have another seizure while they were here. So,
Yeah.
needless to say, within 5 hours of the first seizure on that day, he was in the hospital. So we found out he was allergic to the infusion that they were giving him. So that was stopped. He is on Keppra, which is a seizure medication. The neurologist is saying he doesn't think it was caused by the medication, but I am leaning toward the oncologist and his myeloma specialist who have more knowledge of what this medication can and can't do and what the side effects could be, and I'm leaning toward what they are saying and that it was a reaction to that medication. We're hoping in February of next year that he comes to off the Keppra and can start driving again.
Yeah, I'm hoping so, but we'll wait and see for that. But that's the update. I feel a whole lot better now that I'm not on that medication. I'm still taking one other medication. They decreased it to
It's
once.
an oral chemo.
It's an oral chemo, and it's and I'm also taking another medication through my port once a quarter, I guess it
Yes.
is. And so that's all the medications basically I'm taking. That's my maintenance program. I don't know what the results or if there's any difference since I'm not taking all the medications that they suggested, how that might affect my future prognosis or what have you.
We can say that every month when they do the laboratory results, his myeloma labs are normal. So there's not been any change with the myeloma.
Yeah, so that's the main thing right now is to keep it at bay, and so far so good, and we're doing well, and looking forward to our daughter is home now with us, and so she's moved back. Her and her husband have moved back and to Georgia, and
Along with our grand puppy and grand kitty.
yeah, so everybody's home, and we're happy about that and glad to have them back. And that's another part of our support system that was missing, and they're here now, so I'm thankful for that. And just thankful to be here. I've actually started something I never thought I would ever do again. Was I'm helping teach a Sunday school class. As needed, and I kidded them, it's just in emergencies. But I do stumble in my speech occasionally. I have a short-term memory loss. Today I was talking about a subject and I completely lost track, and I guess anybody that can happen to anybody, I guess, but it before this happened, it didn't happen to me very often at all. And I can tell a difference in my mental status. And I also retired in May of this year, 2024. So
Came off blood pressure medicine.
And came off blood pressure medicine due to that. So that was a good thing too. So you have to take the good with the bad sometimes. And I'm just thankful that right now everything looks pretty good. And if you have whether you have cancer or another type of disease that is likely to be life-ending at some point, I encourage you not to stop fighting and to consider treatments, consider what quality of life you might have after those treatments, and talk to the doctors, and get your regular checkups. This was noticed and just a basic blood test that my doctor did because I was anemic every time I came into the doctor's office. I was coming in a lot because of my diabetes, and he noticed it and sent me right away to the cancer center, and that gave us a tremendous 3-year heads up for this process, and also allowed them to begin treatments right away. I hear of people having tremendous back problems, severe kidney issues before they find out what it is, and it was really great to have that big heads up excuse me, that heads up before we all entered into this. So it helped a lot. So we appreciate you watching. Hope that you receive some blessing out of this time that we've shared together, and we hope to see you soon. Thank you.
Take care. Bye.